So this next technique we're going to demonstrate is the lower thoracic region from T12, T11, T10 and T9 area. So for this technique, we commonly use the cradle hold, and there are multiple different holds. I'm going to demonstrate two different techniques. So we ask the patient, this time with the lower arm, they cross lower in their body, they hold towards the lower ribs, using the elbow as a barrier between their thoracic region and their elbows. I ask the patient to bend their knees, placing their feet flat. This is not always necessary. I just find this easier for me. I pull the patient towards me. Again, we can find on the posterior lateral aspect, we look for the 12th rib, track up around to find T12, the SP of T12. We can rotate to find the restricted segment within the 4 segments above. Once we find that restricted segment, using the pads of the fingers, locking a hand around, what I do is I come above the elbows, locking my elbow in and pull their elbows directly over the segment being adjusted. Now from here, if the patient lifts their head slightly, you can come under their head, holding onto the shoulder and direct force directly down onto the DL area, dorsal lumbar area. Or what I like to do is to come under their head, hold, put the pads of my fingers along the spine, traction upwards as I pull inwards, looking up, chest up, compress and thrust down towards the table to create a cavitation. Similarly, to find those barriers, we can either use our rotationary motion, our side bend movements, and our flexion and or extension. But as I've just demonstrated, simply all you need to do is to collect all the barriers at the same time and thrust. There we have it, guys. A nice simple dorsal lumbar junction HVT manipulation using multiple holds.